What is RSV? Respiratory syncytial virus is a seasonal respiratory virus that usually causes mild, cold-like symptoms. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults. What are the symptoms of RSV? People infected with RSV usually show symptoms similar to a common cold within 4 to 6 days after becoming infected. Symptoms include runny nose, decrease in appetite, coughing, sneezing, fever, wheezing, lethargy, trouble breathing. Who is most vulnerable to RSV? Those most susceptible to RSV are premature infants, newborns and babies, especially those younger than 6 months, children younger than 2 years old with chronic lung disease or congenital heart disease, and children with weakened immune systems. Similarly, older children and adults with chronic heart, lung or immunity problems can also be severely impacted by RSV. When should I take my child to the hospital emergency department if I suspect RSV? If your infant is in distress, not eating, not drinking, having trouble breathing or has a high fever, take your child to your local emergency department, ED. EDS will triage incoming patients and treat those with the most acute symptoms immediately. If you are unsure or if your child has milder symptoms, contact your child's primary care physician, advice nurse or local urgent care facility. How is RSV diagnosed? Most children with cough, cold and breathing problems can be diagnosed by their primary care physician, but RSV can only be confirmed by a PCR test, nose or throat swab, which is usually done on the sickest patients and those who require admission to the hospital. Is RSV contagious? RSV is highly infectious and spreads by close contact through droplets containing the virus when someone coughs or sneezes. It is also spread by touching items and surfaces, like doorknobs and toys, contaminated with droplets, and then touching the nose and eyes. Direct contact with the virus, like kissing the face of a child with RSV, also spreads the virus. This virus remains active on surfaces longer than most, so it is important to wash your hands and disinfect surfaces regularly to reduce the spread of the infection. How long is a person with RSV contagious? People with RSV are usually contagious for 3 to 8 days and may become contagious a day or two before they start showing signs of illness. However, some infants and people with weakened immune systems can continue to spread the virus for as long as 4 weeks, even after they stop showing symptoms. How is RSV treated? Most RSV infections resolve on their own in a week or two. Antibiotics will not help unless there is a secondary bacterial infection. You can manage RSV by getting ample bed rest, taking over-the-counter fever reducers and pain relievers, such as acetaminophen or ibuprofen, to manage fever or pain. Never give aspirin to children. Drinking plenty of fluids to prevent dehydration. Be sure to check with your pediatrician before giving children non-prescription cold medicines. Some medicines contain ingredients that are not good for children. Thank you.